My name is Kortney Bellm. This is my halfway video for health assessment. Today I'm going to be interviewing my patient, and I'm going to start by a identification. I'm going to ask her for 2 patient identifiers. So can you give me your initials and your date of birth?
My initials are KA and my date of birth is 10/11/1987.
And for the purposes of this video and HIPAA, I'm not going to use her actual first name. I'm going to call her Laverne. So I've entered the room and I perform hand hygiene. I've provided privacy to my patient. I'm going to be asking her what has brought her here today.
I'm just here for a general physical.
Okay. I'm going to, while I'm sitting here and getting to know the patient, I'm going to be paying attention to her overall general appearance. Is her skin appear to be pink and dry? Does she have any lesions that are visible? And does she appear to have good hygiene? Is she clean? Are her clothes appropriate for the weather that we are having? And all of that appears to be good. I'm going to ask her to stand up. We're going to check her mobility a little bit here. And what I want you to do is I want you to stick your hands out in front of you and turn your hands over like this. Flex your arms back and down, and then flex and extend your wrists. Okay? Now you can sit back down. Now with your legs, I want you to stick your legs out in front of you. Okay? And now flex and extend your ankles. Good. And bend your knees. Pull one knee to your chest. Good. And the other one. Okay. She appears to have full range of motion of all of her extremities. I'm also going to be paying attention to her posture. Does she sit erect? Does she slump? She appears to be erect. There's no slumping. She doesn't appear to have any curvature of her spine. I'm also going to be paying attention to her nails and her hands. Do they appear to be brittle? Does she have any clubbing in her fingers? No. That would indicate a cyanotic or a respiratory event, and she does not. Her nails appear to be strong and normal. Her skin appears to be smooth and dry and pink. Also, I'm going to be paying attention to her mood, her affect. Does she appear to be happy, and she appears to be in a good mood? Her speech is clear. I can hear her. She maintains eye contact. Her level of consciousness, she is alert and oriented. Can you tell me where you are today?
Mercy Hospital.
Okay, and can you tell me the month?
September.
Okay, so she is alert and oriented ×4 to person, place, time, and situation. Then we're going to just start the objective data part of the assessment. I'm going to start from the top of her head and I'm going to work my way down. So what I'm going to be paying attention to is her hair. Does her hair appear to be clean? Is it dry? No, her hair is clean. Does her head appear to have any deviations? Is there any asymmetry to her head? No. I'm going to palpate her scalp to check for any kind of asymmetry of her scalp. And she doesn't appear to have any asymmetry or any kind of lesions that are visible. Next I'm going to palpate her temporal artery. And it is a 2+, which means that it is normal. It is not bounding nor weak. I'm going to inspect her temporomandibular joint by placing my fingers right behind her jaw and asking her to open her mouth and close her mouth, just to inspect that there is no popping or clicking when she opens and closes her mouth. That would indicate something like lockjaw or TMJ. Next, I'm going to palpate her maxillary and her frontal sinuses. What I'm looking for is any swelling. Does she complain of any tenderness upon palpitation, which would indicate sinus infection or possibly allergies? So I'm going to palpate with my thumbs like this, and I'm going to ask her, does that hurt?
No.
Okay, any soreness when I palpate?
No.
Okay. So her sinuses appear to be normal. Then I'm going to move to her eyes. And what I'm going to do is I'm going to check to see if her eyes are her pupils equal? Are they round? Are they reactive to light? And do they accommodate? So first I'm going to look at her eyes, and her pupils appear to be a 2, which is normal. They also are round and equal. Next I'm going to check to see if they're reactive to light. And what I'm going to do is I'm going to shine a light in one eye and see what kind of a reaction we get. What you're looking for is a pupil constriction with light. Now, in a normal situation, you would want to dim your lights or provide lower light, but for this purposes in the video, I'm not going to do that. So I'm going to shine a light across her eye like this, and her pupils do constrict to the light, and I'm going to do it again. And then you perform the same test watching the other eye that you do not shine the light in to see if you get a reaction from there. And you do on both eyes. And then we're going to check for accommodation. And what you do is you ask your patient to focus on a point anywhere in the room. Okay? And then I'm going to start with my finger out here, and I'm going to move it towards the patient's face. And once I get it to the spot that I want it to be, I'm going to ask her to focus on my finger. And what I'm looking for is a pupil constriction, and to accommodate for the nearer object. So focus on your point. Okay? And I'm going to move it in. Now look. Okay? And her pupils do accommodate. There's a few different tests that you can do to check your eyes. One of them is called a confrontation test. And what you do is you have your patient cover one of their eyes. So cover your left eye, and then I will cover my right eye. And what I'm going to do is this is checking your periphery. So I'm going to start at a point and see that whenever I move in close, that we both see the appearance of my finger at nearly the same time. Okay. Huh? Okay. So look at my finger. No, look at me, sorry. Focus on me, and when I move in close, you tell me when you see my finger. Huh? Okay, you tell me? Yeah. Okay, so we both saw the appearance of my finger in the periphery at about the same time. Another one that you can do is called the corneal light reflex. I'm not actually going to perform this because it can be somewhat irritating to the patient. But what you do is you take a small piece of cotton, or in this, I have a Q-tip, that would work too. And what you do is you touch the outer portion of the eye with the Q-tip and see that there's a reflex. What they're going to do is they're going to squint or try to shut their eye. And that is a positive corneal reflex test. I'm also going to check for the 6 cardinal positions of gaze. And what you do is you start at 3 different positions on each side, and you just have your patient follow your finger. And what you're making sure is that there's no nystagmus or eye shaking or movement, that it's just one fluid motion all the way with your finger movements. So I'm going to start on this side. I'm going to tell Caitlin to watch my finger just with her eyes, not with her head. So, okay, watch my finger and follow it all the way to the center. And again, and again. All right, and then you move to the other side and you do the same thing. Okay, and Laverne doesn't exemplify any deviation. She follows my finger fluidly in a solid motion. I'm also going to inspect her eyes, and what I'm looking for is that her sclera appears to be the white, which is the white of her eyes, and it does. I don't see any redness or any appearance of blood vessels. I'm also going to pull her eyelid down and inspect her conjunctiva, and it appears to be normal, the blood vessels are apparent. I'm also going to check to see that her irises are normal and equal on both sides. The next thing I'm going to tell you about is a Snellen chart, and I don't have a Snellen chart for this test, but I'm going to explain it to you. So a Snellen chart basically is a vision test that is a piece of cardboard that shows all these different letters that you are going to ask your patient to repeat back to you. What you want to do, normal perfect vision is 20/20. So you're going to have your patient stand 20 feet away from the chart, and you're going to start with different lines on the chart and see each line. The further you move down the chart, the letters appear smaller, and that is how you distinguish vision. And the smaller the letters that your patient is able to read, the better the vision they have. Okay, so that's it for our eyes. The next thing that we're going to do is we're going to check her ears. The first thing I'm going to look at is just the outer portion of her ears. Do her ears appear to be symmetrical? Are there any kind of lesions on the outside or anything of concern on the external part of her ear? Caitlin, are you experiencing any discharge from your ears? Do you have any problems with hearing?
No.
Do you wear any hearing devices?
No.
Have you had frequent or infrequent even ear infections or swimmer's ear?
No.
Okay? So next, what I'm going to do is I'm going to obtain an otoscope to inspect the canal of her ear. What I'm looking for is her tympanic membrane. What I want, or a normal finding, would be that the tympanic membrane appears pearly and a grayish color. And the way that you inspect the ear canal is the pinna, or the top part of the ear. You want to pull it up and back, and then you want to turn your otoscope upside down and insert it just partially, not too far, into the ear canal, and look into your little light area. And her tympanic membrane does appear pearly in a grayish color, so that's normal. She doesn't have her ear canal is patent. She doesn't have an excessive amount of earwax that would inhibit any kind of hearing. Next, I'm going to do the whisper test, and what I'm going to do is I'm going to have Caitlin press on the tragus, or the little part of the ear that sticks out, and have her press it down, and I'm going to cover my mouth on her side, and I'm going to speak a series of numbers and letters, and I'm going to have Laverne repeat them back to me. Okay, so cover your tragus. Okay, 6A4.
6A4.
Okay, and I'm going to do it on I would do it on the other side just to check for hearing. And Caitlin appears to have normal hearing, and everything. Her ear canals are patent. She doesn't have any lesions on the outside. They are smooth and warm. So next, I'm going to inspect Caitlin Laverne's nose. I'm going to ask her first, do you experience any discharge or nosebleeds or any kind of issues regarding your nasal passage or anything?
No.
Okay. Then I'm going to look at her nose. Is it symmetrical? Yes, it is midline. There's nothing abnormal on the external part of her nose. Then I'm going to use my otoscope, and I'm not actually going to do it for this purpose, but for the video, but you would just stick your otoscope in the nose, and what you're looking for is patency. Does she have any polyps or any kind of lesions inside her nose that would inhibit her ability to breathe through her nose? So I'm going to look, and Caitlin doesn't appear to have any polyps or lesions. I'm also going to ask Caitlin to cover one side of her nose and breathe in through her nose. Okay? And do the same on the other side. This is just checking for patency. Is she able to breathe through her nose without any kind of issues? Also, when inspecting her nose with the light, I'm looking for at her septum. Is there any deviation in her septum, which is common in a lot of people. The only time that it is an issue is if you have obstruction during breathing or excessive snoring, and then they would surgically repair that. Caitlin's septum does appear to be normal. Her mucosa is pink and dry. It's not, there's no lesions or anything like that, like I said. Her turbinates do appear to be normal. There's no deviation of those. Next, I'm going to look at Laverne's mouth and see that she that everything is normal there. First, I'm going to start with her lips. Do you have any issues with your lips? Any dryness, peeling, cracking?
Dryness.
Okay, and what do you do for that?
Just chapstick.
Okay, and that works for you?
Mm-hmm.
Okay, so her lips appear to be a little bit cracked, but I can tell that there is a moisture barrier on them right now. And next I'm going to ask her to open her mouth for me. Okay, and stick out your tongue. Okay, and move it up and down for me and side to side. Good. And say ah. Okay. Open your mouth one more time for me. And press your tongue down to the roof. There you go. Okay, so I'm looking to see if her tonsils do appear, and they are a 1+, which just means that they are barely visible. Also, when she says ah, I can tell that her uvula is midline, and it moves appropriately. Her mouth does appear pink, moist. I don't see any lesions or anything of concern inside her oral mucosa. Her teeth, can you open your mouth one more time for me? Her teeth all appear to be intact and present. Do you have any cavities or anything?
No.
Okay. And do you wear any kind of dental appliance?
No.
Okay. So no dental appliance, no cavities. They are all in place. They appear to be clean. Her gums appear to be pink. They are not reddened or inflamed, which would indicate something like gingivitis. I'm also going to check Laverne's gag reflex. And what I'm going to do is I'm going to insert this tongue depressor, and I'm just going to very carefully stick it in the back of her mouth to see if I can elicit a gag reflex. So open your mouth for me. And we have a positive gag reflex. Okay, next I'm going to inspect her neck. What I'm checking here for is, first, is it symmetrical? And it does appear to be symmetrical. It's midline. She does have a normal size neck. It's not short. It's not really long. It just appears normal. And then I'm going to palpate her neck. What I'm checking for, does she have any swollen lymph nodes, any pain when I palpate your neck?
No.
Okay, I'm also inspecting for jugular vein distension, and she doesn't elicit that. I'm also going to check her carotid pulse, and you want to do it one side at a time. You don't want to be doing both. And she does have a 2+ on both sides. Her trachea appears to be midline. I'm also going to check her thyroid, and what I'm gonna have her do is I'm gonna have her turn her head, look down a little bit, and turn your head to the right. Okay, and you want to place your hands kind of on the trachea, displacing it a little bit, and ask her to swallow. Okay, and then do the same thing on the other side. Okay. Okay, and in a adult female, you would not be able to palpate a normal thyroid unless it was enlarged or something like that, or she had a goiter. So Not being able to palpate it is normal, and I wasn't. I'm also going to ask her, does she have any issues with swallowing or any choking or anything like that? Okay? And next, I'm going to ask her to move her neck from side to side, okay, and up and down. And I'm just looking that she has full range of motion in her neck. And she does appear to have full range of motion. Next, I'm going to start with her. I'm going to go to her chest. I'm going to use my stethoscope here. Now, there's two different ways that you can auscultate with a stethoscope. There's the diaphragm, which is the small part of the stethoscope, and there's the bell. Is that right? And so on this stethoscope, it is self-tuning, which means that I don't have two different sides of the stethoscope, but in order to auscultate heart sounds like murmurs and things like that, you are just apply less pressure when listening to the heart sounds, and to hear normal sounds, you apply more pressure. So when I am listening to her heart sounds, I'm going to start at the second intercostal space, right sternal border, and that's going to elicit the aortic valve. And then I'm going to move to the second intercostal space, left sternal border, to elicit the pulmonic sound, and then to the fourth intercostal space, left sternal border, and that will elicit the tricuspid sound. And then the fifth intercostal space, just under the breast tissue, left midclavicular line, and that's going to elicit the mitral valve, and that's also where you would count your apical pulse for 1 full minute. For the purposes of this video, I'm going to count it for 30 seconds and then multiply it by 2 to give us our heart rate. Okay? And women especially, sometimes you have to, lift the breast tissue. You just have to maintain some privacy and let them know what you're doing. Okay, and now I'm going to count the apical pulse for 30 seconds. Okay, so her heart rate is 60. I counted 30 beats and multiplied it by 2. That is normal, and somebody who is resting, they're not, she is active and fit to have a lower resting heart rate is a normal finding. I also am listening whenever I was auscultating. You're listening for an S1, S2 sound, which is the lub-dub sound. That is normal. If you have any other sounds that would indicate, a gallop or anything like that, she did not elicit those sounds. Her heart sounds were easy to hear, which would be a grade 3. That's a normal finding that you don't have to, they're not distant, they're not muffled, there's no deviation from that. Also, her rate is regular. She doesn't have any kind of heart, like atrial fibrillation or anything like that. I'm also going to palpate her radial and her brachial arteries. They are 2+, which is normal. They're not bounding or weak. Next, I'm going to listen to her lungs. I'm going to start on the back side of her chest. I'm going to ask her a few questions like, Laverne, do you experience any shortness of breath?
No.
Frequent cough?
No.
Any pain on inspiration or expiration?
No.
Any recent respiratory, lung, any kind of infection?
No.
Are you a smoker?
No.
Okay. So what I'm looking for is, with each inspiration, is it symmetrical? Take a deep breath. It is symmetrical. Her skin is also pink and dry. You don't want any kind of dusky or dark. That's a cyanotic event, and that would be abnormal. The landmarks to listen to the chest, you start at the upper portion of the clavicle on the back side, and you just move right to left or left to right, whichever you want. So you go to the upper 1/3 of the clavicle, and then the second intercostal space. Yes. Third intercostal space, fourth, fifth, sixth, seventh, and the ninth, which is the mid-clavicular line on the outer portion of the backside. So I'm going to listen to that. I want you to do for me, Laverne, is each time my stethoscope touches you, take a breath. Okay. Okay, and her breath sounds are clear. She has normal chest expansion, no exertion of any kind of accessory muscles. No, her breath sounds are not diminished. I can hear them clearly. Another thing that I'm going to do is I'm going to check for tactile firmitus. And what you want to do is you take your stethoscope and you press slightly to the chest, and you ask the patient to say 99. And what you're looking for is you're listening for vibrations, which indicate a normal finding. So each time I touch you, say 99.
99. 99. 99. 99. 99. 99.
Okay, and that is normal. I can hear the vibrations in her voice. Also, you can check percussion of the patient, and what you're looking for is a medium, clear resonance each time that you percuss. And how I'm going to percuss is I'm going to gently place my hand on her back, and I'm going to gently tap on my hand. Okay, and I do elicit a medium, clear sound, which is normal. Okay, now I'm going to ask Laverne to lay flat on her back for me.
On my back?
Yes. And I'm going to listen to the front part of her lungs. You do the same thing on the front side. It's just a little bit, the landmarks are just a little bit different. So you start at the 1/3 of the clavicle to the second intercostal space, third, fourth, fifth. And this would be your mid-clavicular line. Okay, each time I touch you, take a breath for me. Okay? Okay, and her breath sounds are clear on the front side. Her rate is regular. while you're doing this, you should be counting your patient's respirations. You don't want to do it with them really knowing that you're doing it, to elicit a more accurate finding. Also, there's a few other tests that you can do to check for your patient's hearts, their lung sounds, to make sure that there aren't any issues. Now, all of my findings were normal, but there's an egophony test that you can do, and what you do is you ask your patient to say E while you listen to them, and you're listening for the vibration and the resonance of that finding to see that the lung sounds are not muffled, and you can also do a bronchophony test, which, just like the tactile phrenitis test, you have your patient say the letter 99, and what you're looking for is a soft, muffled sound when they say that, and that would be elicit a normal finding. And this concludes our health history halfway video. Thank you.